Hi, I'm Dr Rupert Suckling. I'm the Director of Public Health here in Doncaster. We're now almost 2 weeks into Step 1A of the release of national restrictions, and as we would have expected with the return to schools, we have seen a small increase in the number of cases in Doncaster. Our rate for the 7th to the 13th of March is 113.8 per 100,000. Although this was expected due to the schools reopening, it does really emphasise the importance of needing to tread carefully as we walk the fine line of keeping our figures as low as possible while enabling more mixing as we travel through the roadmap. Although children are now mixing in schools, it's important that they continue to follow the guidelines when they're out of school and on the way to school, and avoid the temptation of over-socialising with friends. This may seem unnecessary when they're mixing in school, but every single contact is an added risk. And for now, we need to limit the risk as much as we can to keep our children in school and our rates down. Although we have seen the increase in rates for the 13 to 19 year age group, a closer look at the data leads us to believe that this increase is not just due to the reopening in school. It also appears that a number of cases are in the 18 to 19 age group, and this is likely to be due to working environments too. In fact, the biggest increase in cases across Doncaster currently is in the 20 to 29 year age group, and again this leads us to believe that the majority of transmission is happening either in the workplace or on the way to and from the workplace. If you can't work from home, then I would urge you to make sure that you're doing everything that you can to reduce your risk and take up the offer of testing. If testing is not available in your workplace, then you can access one of the community testing programmes in Hexthorpe, Stainforth or Conisbrough. This week officially marked the 1 year anniversary of the first confirmed case of COVID in Doncaster. A lot has happened in that year, and to think we are now in a position where 12 months after the first case we vaccinated almost 120,000 people in Doncaster is truly remarkable. I know there have been lots of media stories about the safety of the AstraZeneca vaccine over the past week, but the evidence clearly shows that the vaccine is not only safe but also extremely effective. So please, when it is your turn and you're called for your vaccine, I urge you to come forward and get it. Next week marks another significant milestone in managing our local response to the pandemic, as we begin to manage the test and trace programme here completely at a local level. What that means is that we will be able to start contacting people and identifying their contacts within an hour of a confirmed positive test. This is exciting and important, as it will give us the tools we really need to get a tighter grip of where the virus is being transmitted at a hyperlocal level. And hopefully this will allow us to interrupt the transmission of the virus even earlier. As always, I want to thank you for all of the continued sacrifices you're making to support us to get Doncaster's rates as low as possible and stop the transmission of the virus. Every single thing that you're doing does make a difference, so please keep it up. Let's do it for Doncaster.